Let's find out more with the CEO and founder of Arutala, Indra Haryadi. So he's the founder of Arutala, and Mas Indra Haryadi is joining us right here today on the C Morning Show this morning. Good morning, Mas Indra.
Good morning.
Good morning, everyone.
Thank you for being here with here. By the way, I like your Arutala. We craft reality. I love that motto right there.
Thank you very much.
Mas Indra, thank you so much for joining us right here with us as we like to delve to our question discussing about the ventures of Metaverse right here, especially in Indonesia. Now, you have created several technologies that use augmented virtual reality, and one of them is Cardia AR, which can help analyze heart anatomy. Now, how different is it compared to using conventional equipments, Mas Indra?
Okay, thank you very much. Yeah, so basically, if you want to compare the differences between the AR apps with the conventional ones, there's three mainly things that we can see. The first is about the size and the weight, of course. If you want to learn wherever you want with the conventional one, then you have to carry it around. So I think it's about this much, and there's a weight on it too. But if you are using the IR Cardia apps, then the size and the weight is just as big as your smartphone. And that's also related to the second. Yeah, the second one is the distribution. Imagine if you run a medical faculty and you need to distribute many conventional cardiac props to your student, then it will take some effort. But with these AR apps, you can distribute it very easily to all of your students. And link to the number three is they do not just happen to learn about the cardiac, but they can also do other functional that it actually sometimes cannot be done with the conventional ones, like simulate how the cardiac works and stuff.
Right.
And so I think that's quite the difference between the conventional one and the AR apps.
It seems like the students are getting ready for the real world, right?
Yes.
Even though they're still, in their studies and whatnot, but it seems they can already, being a part of it.
Exactly.
Through this AR.
Yes, and it's actually helping them to practice as well, not only using the real bodies, right? But in technology, there's phases of developments. What do you think is the level of accuracy of Cardia AR right now in depicting heart anatomy? Can you say that it's very accurate, or is it still, not very much depicting reality?
Okay. Yeah, so basically, if we want to say about the accuracy, then currently our partners in FKKM KUGM, they're actually doing an evaluation about the effectiveness of these learning props to be used in medical learning. Yeah, but some of the early feedback that we received from early user is actually quite promising. So we see that maybe it cannot replace 100%, but it can complete what the physical one cannot give. And I think moving forward, we will see more of this approach to be done in medical learning area.
Right. And also we heard that Arutala is also helping to train health workers through Metaverse and VR. Can you share about it a little bit more with us, Mas Indra?
Yeah. Okay, thank you. Yeah. So basically, we also, other than the IR cardiac apps, we also have created some Metaverse, like on the screen, some Metaverse apps that's run in the Oculus headset. It's what you can see on the screen, and it can help medical student, in this term is a nurse, to learn about the practical things that they need to do in the hospital. Yeah. In fact, do you want to see the live demo right now?
Yes, please. Because we heard you're in the hospital right now. Please do so, Mas Indra.
Yeah. So it happened to be I'm in the RSUD Karina Tegal, and here I will ask Ms. Vinda, one of the health workers, to actually try our product. It is the VR Tri Edge. So this is what she sees. Okay. So it helps nurses to understand about what should be done when the patient arrives in the emergency room. So it's called the Tri Edge. This is there is so many cases. If we want to try it using a conventional way, then we have to get as many patients as we can, and that took so much time and maybe a lot of financial effort too. So with this, early nurses can learn how to treat patients based on the priority and learn it multiple ways. So instead of they learn it in the hospital, they can bring it to the campus and their home.
Right.
Yeah.
So it's cutting expenses, it's cutting out time, it's more convenient also.
Yeah.
All right,
Yeah.
so
Okay, so thank you, Ms. Indra.
Thank you, Masinda, for sharing that projection with us too. Now, do you think the implementation of these technologies in several hospitals across Indonesia is visible, especially coming to this new year, Masindra?
Okay. Well, in fact, right now we are in the RSUD Karina. We are happy to share that this is going to be our first relationship with the hospital itself. Yeah, thank you very much. And here we are trying to bring the values of Metaverse into the healthcare institution. And the interesting thing is actually when we talk about healthcare and the Metaverse, sometimes the cases that we can bring to life is not just about the medical practice itself. If you can see right here, there is a bunch of pictures. This is the picture of Raden Ayu Kardina, the one who's actually founded this hospital. Raden Ayu Kardina is the sister of Raden Ajeng Kartini.
Yes.
Yes. And what we try to bring here is actually, we try to bring the heritage value, the historical value of the RSUD Kartina. So the people that actually came, to this hospital, they don't just come for.
Now there's some historical values that you input, right, to the hospitals and to the premises also.
Correct.
Well done.
Correct.
Wow, so it has varieties of usage, not only for the medical students or nurses, but also for the heritage value as well, right?
Yeah.
Ms. Indra, so what you're showing us is basically two different things, right? There's VR, which is virtual reality, and then AR, augmented reality, with the one with the heritage value. So can you share a bit to our audience what is the difference between AR and VR, and why they have not been used in the Indonesian health and education sector? Because we've seen a lot of values from there, right?
Yeah. Okay, correct. So the first is about the difference. So if you can see before, so when Ms. Vinda, the nurses in the Karina is using the VR, she's actually kind of like entering a new reality. So she felt that she's not in the Karina hospital, she's in the another place, another hospital, and she trained with the flow that we already created for her. But on the other hand, the AR is actually like we bring the virtual object into our world using the phone or the tablet. So the differences will be the environment.
Right.
And then the question about why there haven't been so many implementation in the healthcare field with the usage of the Metaverse. Well, maybe because the first is Metaverse is still very, very new. Before Metaverse, there's a technology called immersive technology. Metaverse is one of the slogans that Mark Zuckerberg invented, and it makes people realize that there's this immersive technology called AR and VR, and it can help people moving forward to learn, to shop, to interact and everything. But it's still very, very early. So that's why we are also hope that we can collaborate, or everyone can also explore the possibility of this Metaverse to help them to do something that usually hard to be done in a conventional way.
So, Masindra, what do you think are the factors that we can enhance, especially right here in Indonesia, so then we can use augmented reality, VR, and also Metaverse easily equipped by the public?
Okay. So in my opinion, there is three main factors that we need to put effort to make this metaverse implementation is widely used in Indonesia. The first is actually about the device. So it's actually in Indonesia, yeah, the device itself. So actually it's quite hard to procure one in Indonesia because there has not been many VR device that officially enter Indonesia market. So yeah, we hope that moving forward, many principals are officially coming to Indonesia to sell their metaverse device to help us, yeah, implement this in Indonesia. And then the second one is actually about the awareness. So I really thank you with the C today because we can share the awareness together to all of the people in Indonesia. Because many people are still confused about what is the metaverse? How can it help us? Is it just a hype, or there's actually the real value in it? Yeah, and I think constant education about how metaverse can really bring values to how you work, how you live is need to be done consistently. And then the third one is actually about the research. So metaverse is still a field where many companies, many people in the world are still researching it. This is the frontier of technology. So in Indonesia, there's still not been any focused research about the metaverse itself. So when maybe government can induce this to make people research more about the metaverse, then I think we will see a lot of implementation of metaverse in Indonesia.
Oh, I like that.
Wow, yeah, so good. Obviously, this is something that Mark Zuckerberg has just bringing to the mainstream when he introduced Facebook to Meta. So of course, it's going to be needed a lot of constant education and awareness, just like you said yourself, for people in Indonesia to know that this is not just a hype. This is actually the frontier of new technology that can bring a lot of values to different sectors. Right? And I'm pretty sure healthcare is just one of them.
Yes, and of course, Arutala, thank you so much for bringing this awareness to us, to our audiences, especially to Indonesia and Southeast Asia and to the world. And of course, Mas Indra, this is not going to be our first time and last time being with you.
Yeah.
We're going to have many more fruitful discussion, especially about Metaverse right here in C today with you and also with Arutala. Thank you so much for your time, Mas Indra.
Thank you so much, Mas
Have a
Indra.
great weekend.
Thank you.
And success always.